So the scar also will be very minimal because I removed. Wow, that's come out very well. Oh shucks, what is that? Okay, that's nice. This is going to hurt a bit, huh? And this is what now? 8th day, 7th day?
It's the 8th day.
So she had complex facial asymmetry, and we did multiple procedures. And well, I think we've augmented her facial aesthetic significantly. We're going to show you how she looked in a while. Huh? So first you can see the asymmetry that was there, because we can also see the side view, you know. Yeah, but this is the side view that she had. You want to look at me a little bit? This side? Yeah, a little bit. So she had a huge hollowing there. That was from the earlier surgery. And then there was a huge muscle bulk here and a bony projection. Bony projection contoured, muscle projection reduced, and we basically moved it down to give the normal contouring. That's one of the major work that was done. And then, yeah, you can see in this picture too. Sorry, it's not the best pictures that we have. Okay. And then this is a side view from this side, where you will notice very clearly that the chin has been augmented. So the chin has come forward. Again, you can see, hey, where did you have a look? Come on, give her a mirror. So, so she's also a doctor. So, and a very nice doctor. Look that side. So to your left, so you can see the difference. See, there is no jawline defined. Now you see how it's sticking forward. Earlier there was like you know, the neck jaw line was almost a straight line. And we've given you a chin. So 1, 2, okay. Then you move on to the asymmetry part. Look at this. Well, I'm not saying it's 100% okay, but it's improved. बहुत improve है, okay. ये अंदर जाएगा काफ़ी और, and तो फिर ये सब सूजन कम होगा. There will be good, much improved symmetry. Sorry. So this is the front view, and yeah, as you see, we'll remove this. Yeah. Okay. It's going to get better, doc. Okay. So you send us pictures after 4 weeks. Take very good care. Now, there are a couple of areas we are concerned about your intraoral healing. Yeah, so we'll wait there. We'll apply some gel, and it might take another week or so. And then the swelling all will take maybe 4 weeks. Darad ho raha hai kahin? Not much pain anywhere, right?
I'm just bleeding intraorally.
Little now and then, but no pain anywhere. That's awesome. And you're taking good care, good intraoral care, good diet, and no sleeping, preferably on both the sides. But if you have to sleep on a side, choose the right. Left is really no. Okay? And one scar cream for this, and some tablets for reducing swelling, and all the best.
Thank you.
And be in touch. So let us know how you're doing after a few weeks. We're also going to give you a dedicated follow-up number. Okay? Anything you want to tell me, subscribers? Kuch nahi?
I just want to thank you. Thank you so much, sir.
You're
Thank you
welcome.
so much.
Take care.
Yeah.
Chalo.